In the video about bias, we have briefly mentioned confounding as a specific type of bias. Confounders are factors that can influence the true association between the determinant and the outcome. Fortunately, the presence of confounding can be evaluated with stratified analysis. The same analysis can reveal a similar type of bias, interaction. What this entails we will discuss in this video. Imagine you want to research socioeconomic status as a confounding factor in the effect of maternal smoking on the birth weight of newborns. Stratified analysis can be used to evaluate this. The first step is to analyze the results in two groups, with high or low socioeconomic status, also known as SES. Suppose the following distribution of SES is found. As you can see, the difference in birth weight between smoking and non-smoking mothers seems to be 500 grams, but the outcome will be different when conducting a stratified analysis. Let's look at the results. Now, there is a difference of 200 grams in birth weight in the low SES group as well as in the high SES group. We can conclude that the initial estimate of 500 grams was confounded by SES. It is important to note that a confounder can only have an effect if it is present differently in the groups. In these groups, the difference is clear: 80% low SES in smoking women, 40% low SES in non-smoking women. If the two groups were randomized and had equal percentages of low SES, the unstratified analysis would reveal the true effect of smoking, since the effect of SES is the same in both groups. Stratified analysis can also be used to reveal another concept related to bias, which is called effect modification. This is also known as interaction. To be clear, interaction is not bias. Interaction occurs when an exposure has a different effect among different subgroups. In other words, the association between two variables depends on a third variable. In our example, maternal age could be a modifier of the effect of smoking on birth weight. Similar to confounding, interaction can be revealed by stratified analysis. Suppose our stratified analysis showed these results. The effect of smoking is -200 in younger women and -600 in the older group. This clearly shows that the effect of smoking on birth weight depends on age. In other words, there is interaction of smoking and age on birth weight. To answer the question, what is the effect of smoking on birth weight, you have to specify age in order to give the most correct answer. Confounding and interaction may seem similar, but there's an important difference. Confounding is associated with both exposure and outcome. Interaction is only associated with the outcome. Let's illustrate this with the following examples. Smoking is a confounder in the first example because smoking is related to both the exposure and the outcome. Smokers are more likely to drink alcohol, and people who have oral cancer were probably smokers. Smoking is an interaction in the second example because smoking is only related to the outcome. Smoking is not related to exposure to asbestos, but it is a risk for lung cancer. Confounding can be neutralized, for instance by randomization, but interaction cannot. Interaction is in the biology of the mechanism, so it is always present. Summary: confounding and interaction, also called effect modification, are types of bias that can influence the true association between the determinant and the outcome. Confounding and interaction may seem similar, but there is an important difference. Confounding is associated with both exposure and outcome. Interaction is only associated with the outcome. Stratified analysis is used to evaluate the presence of these factors.